Hi, I'm Brenda Kazire.
I'm Nancy Hireman.
And I'm Eleanor Crescenzi, a certified nurse's assistant.
So Nancy and I are hospice nurses. We're palliative and hospice certified, and we've been nurses for over 40 years at the bedside taking care of hospice patients. And we really recognize the need for people having information how to take care of the hospice patient at end of life, because it can be overwhelming and scary if you don't know how to do it. So we built a small company. It's called Odinata Care, and we have tools to help people take care of hospice patients. Our first one is this booklet, A Path to Comfort, Caring for the Hospice Patient. In there you'll find how to care for symptoms that arise during end of life, how to manage medications, when to call the hospice nurse. All your major issues are there. And our other very helpful tool is our YouTube channel, Odinata Care, where you can find short videos on how to care for the hospice patient, how to change a brief, which seems like rocket science if you don't know how to do, how to pull somebody up in bed and position them when you're by yourself, how to put a draw sheet on the bed. And today we're going to show you how to do a bed bath.
Okay, so we're going to do the bathing, and we want to make sure that you have really thought this through. Your patient has been included in the decision making if possible, so that they know that this is coming. They're not, it's not sprung on them. We want to make sure that your room has been made very comfortable, cozy, warm. You have all your supplies ready to go, so you don't have to run and get things in the middle of it. But we do want to have everything prepared and make sure that the patient is also prepared. If you know your patient, like I know Brenda, and boy, she's had some pains when we moved her around in bed. So since I know she's uncomfortable every time we take care of her, I might give her one of her medications that would help her be more comfortable. And I would do that 20 or 30 minutes before the bath, so she's ready for it, and the whole process will be more comfortable.
And if comfort and pain isn't their issue and anxiety is, because you're so vulnerable, then give one of the anxiety medications.
Perfect. And so what we have done, and as you can see, we've got all of our supplies gathered, everything you would need in your own life for a bath. Towels, washcloths, soap, and we're going to need some water. We're going to put it, Eleanor's going to make it hotter than she would expect that Brenda would like, because this process is going to take a few minutes and that water's going to cool down. So she's going to get started. And did you want to say anything about who you are and where we are?
Being a hospice nurse's assistant, I have the pleasure of helping my patients with their bed baths. But as a loved one, you are more than qualified and capable to give your loved one an amazing bed bath experience.
And if you notice, the bed is as high as we could make it, and that's to protect Eleanor, or at home, if you can do this yourself. You put it at a level that's comfortable for your own body, so you're not putting your own back in a vulnerable state to take care of this process. So we are already in a raised state. And of course, you see that Eleanor's putting gloves on. That's because she is hired as a caregiver. And so she's wearing gloves to protect that person from herself. And in this COVID era, she would be wearing a mask as well. If you're a family member and you're totally comfortable with your loved one, there's no need for you to wear gloves. You can just wash your hands. If you needed to change a brief and it had stool in it, then you might want to put some gloves on. But again, use gloves related to the patient's need and your relationship to the patient. The first thing you have to do is get them unclothed. So we're going to talk about that next.
So we're going to get Brenda unclothed while she's in this upright position. It'll help her not have to sit all the way back up, and it'll be up to her capability as to how we follow through with this. I'm going to try, if Brenda's capable, to hook my arm under her arm, set her forward gently, and do a shirt coming off over her head. Now, if she's not capable of sitting forward to do that, I will opt to pull one arm out at a time, put it over her head, and pull out the other arm a little more gentle. But we know she's capable, so I'm going to help her sit up to do this step.
And remember, if your patient or your family member is capable, let them do as much as they can. They want to feel in control of their life, they want to be included, and we want their muscles to be utilized. So ask them to do as much as they can and then assist from there. So right now I'm going to flatten the bed so we can move on to the next step.
And the other thing that Eleanor touched and I think is important is a bed bath. You want to keep on, is don't worry about being a chore. It's a time to connect, a time to tell stories, a time to be touched.
Yeah, whether you're a family member and you want to go back and talk about stories, or if you're the new caregiver, you're getting connected to your patient and they're starting to trust you. Eleanor is going to start this process. We always start from the cleanest to the dirtiest. She's going to start from head and move towards the toes, the complete front of the body, and then we will talk about turning.
Then I have a basin full of soapy water with one washcloth, and I have a washcloth with just rinse water to follow up with the soap.
And remember that this is a vulnerable time. She's going to start demonstrating it, and I'll talk over this. It's a really, you're very vulnerable when you're allowing someone to handle your body. And this is, for instance, if this was Eleanor's first visit, then she doesn't even have a trusting or relationship with this person. So she's going to be very respectful. If there's anything that helps that client be more comfortable, consider it. Maybe you have a family member present while she's doing it. Maybe the family needs a break, and this is a really good time for them to go take a nap while someone else is caring for the client. Put on some gentle music. Sometimes those silences, if you don't know the person, could be a little awkward, so whatever helps you and the client feel comfortable, don't hesitate to try it. You can see that she's washing both arms, soap, then rinsing, and notice that Brenda's lower body is covered with a blanket. We want her to be comfortable, and of course being bathed can be very cooling to the body, so we don't want her to feel cold. And also it provides privacy for her. She's only exposed in the area that's being washed. So as you can see, now we're going to go to the lower part of the body, and Eleanor's going to cover her so she's warm, and again, her privacy is protected as she uncovers the lower part of the body. Maintaining coverage over the groin until she's ready to wash that area. Same process.
This can be uncomfortable emotionally for everybody. Eleanor is used to touching bodies and just comfortable with the whole body process. And the more we approach it with just a matter-of-fact manner, lift the breasts, get under the breasts, get them clean, get in the groin, get under those armpits, get them clean. It feels good. And just think about how you clean yourself and how you want to be clean and how it feels, and just get in there, and you'll find that your comfort increases and so does theirs.
And notice that she put the towel under the legs so the bed isn't going to get wet while she's doing this. And don't remember, again, if you haven't washed someone else, as Brenda said, sometimes we just have this little tentative, afraid to touch their skin like you're going to hurt them. Your skin is really strong. Please don't hesitate to use good vigor to get some of that dead skin off so it doesn't continue to accumulate. And we do see that on elders who haven't been able to reach their feet, that kind of thing.
And at this time we're assimilating, but after getting the lower body, that's when you would raise the towel and get the peri area or the groin area nice and clean. And get in there and get it clean.
Yeah, all those cracks. Good. Spread the legs apart if you have to. And now she's going to have to turn Brenda on her side. If Brenda can move, she's going to do as much as she can. And notice that if she couldn't move, we have this pink sheet here is a turn sheet, and Eleanor would use that as a draw sheet to move her into position. Please see our video on how to turn and position a patient with a turn sheet.
And you see right where Eleanor's hand goes, always to the knee. Because if you raise the knee, the opposite knee, it always guides the body to the other side, and it helps this third turning process. I can help some, so I will.
And now she's going to just get her back. Same process, head to the buttocks. Again, if you have an extra person there, it really helps. I'm going to come over here, and I would help Eleanor by lifting Brenda's leg so that there could be really good cleaning in between all the crevices in the buttocks and the groin area. And if there's been a bowel movement, sometimes it moves, so you've got to get in there and really get everything clean. It's a best time now. You've seen the whole body. You've inspected the skin. Did you see anything that was a problem? Make sure that you put some lotion on And if you are, if this is a patient, make sure if there's a problem, you let your hospice nurse or hospice caregiver know so that they can provide some ideas for treatment of the skin problem. A rash, a scratch, a bed
And when you're
sore.
applying the lotion, really rub it in, massage it in. That increases circulation. Number one breakdown area is right on the tailbone. Massage that. Not only does it help prevent skin breakdown, it feels great.
Good. And now we're ready to clothe Brenda.
We would have done the other side, but we're
Yeah,
assembling.
you would do both sides. Now remember how hard it was to get that shirt off, and that was a stretchy shirt. If it was like an Oxford cloth, really hard to get unclothed. So we have asked Brenda which shirt or the family, what can we use that she'll be comfortable in, but we can alter it. So Brenda has given us a shirt, and as you can see, we've cut all the way up the back of it to within 3 inches of the neck. We've now produced her own hospital gown that will go over her head. It's comfortable. There won't be any wrinkles behind her back. A lot easier, more comfortable for her, and easier to change in the future. So Eleanor's going to put that shirt on, and as Brenda mentioned earlier, you don't need to have pants or shorts or pajama bottoms. If someone is in bed permanently and you're bathing and changing them in bed, leave them unclothed on the bottom. It's hard enough to get a brief changed if you have to take down pants and so forth.
And notice how Eleanor's putting her hand through. Can you explain that, Eleanor?
Of course, it's just the easiest for everyone for me to stick my hand through the armhole of the shirt, and I will proceed to meet my loved one's hand. And just 1, 2, 3, easy pull, just like that.
And again, that little act is just another way of connection, grabbing their hand firmly and pulling it through.
Hospice provides aids, and we can send them to help you if you're a family member, learn how to do this, because the aid won't be there all the time, right at the time a bath is needed, pardon me. So now Eleanor's going to demonstrate putting the shirt over Brenda's head.
Supporting her head through the whole process. And just 1, 2, 3, there you are.
And now you can see that there's nothing behind her back to cause wrinkles and discomfort. Wrinkles do cause skin breakdown. And she's comfortable, and it was much easier on Eleanor to do it. I'm going to raise Brenda's head so that we can just finish up with a few comments.
So, as you can see, it's a complex process, and you won't get it perfectly right, and nor do you need to get it perfectly right. And you'll get better as you do it. And it is a time of connection. So, this booklet you can find online at odonaticare.com. It can be purchased as a download digitally, or you can buy a booklet and have it. We'll send it to you. A lot of hospices provide this to each hospice patient as they're admitted. And don't forget to go to our YouTube videos, Odonaticare, for